Family planning refers to the educational, medical, or practical methods that allows couples or partners to decide if, when, and how many babies they should have. There are different types of family planning methods, especially contraceptives, and they all work differently. The one that is quite common is the oral contraceptives. Then we have intrauterine devices. There's also hormonal injections and subdermal implants. It's also hormonal, but instead of injection now, the implants are put under the skin. Then barrier methods, these are non-hormonal methods as well. Intrauterine devices such as IUCDs, then barrier methods like condoms for men and diaphragms for women. The body's reproductive system is supposed to continue working once family planning methods are discontinued. Hormones get better, back to normal, ovulation resumes, and the reproductive system picks up from where it stopped. In the long run, family planning methods do not affect future fertility. The only one that delays resumption of reproductive activity is the hormonal injection. It takes up to 10 to 12 months after discontinuation before the body gets back to normal. For implants, it doesn't take too long. At most 2 to 3 months, everybody is fine. For the others, like oral contraceptive pills, within a month to 6 weeks, pregnancy can happen. The other ones that don't have any hormones in them, as soon as you discontinue, you should expect something to happen if you try. Family planning is not supposed to stop you from conceiving after it has been discontinued. However, you can have one or two situations where some people may have a longer delay than others. The injections are the most incriminated at this point. 10 to 12 months accepted, but you see people that get longer time before they conceive, sometimes up to 2 years. I've seen some like that in my practice, but eventually at that point there's really nothing you can do than to wait. That is why before you use any method, you see your family planning provider. There is that room for counseling. It is there is no method that is suited for a particular person. From the conversation you will have, you will now determine what best suits you. And family planning methods sometimes may be discontinued because of side effects, and another method will be reintroduced. That is how it works. For someone that has not had any baby, there are some methods that we do not want to use for the person. If you have had a baby or two, there are still some methods that are best suited for you. Some people will complain of side effects after the beginning of family planning. We are not in a hurry to remove or discontinue the method. You can wait for like a few months and see if the side effects will have abated or reduced. If not, we can now consider other methods. The delay becomes a concern if after the stipulated period, maybe in the leaflet or you were told by your healthcare provider, has elapsed and there is no pregnancy. You visit your doctor, but most of the time you can only be reassured to still wait a little while, because medications may not help at this time. Once the time has elapsed, you see your gynecologist, because the thing about these hormones, for some people it takes a longer time for the reproductive hormones to return back to normal, while some it doesn't take that much time because the bodies vary. So tracking, fine, but at this point, there's really nothing you can do other than to just wait it out. Medications will not be of much help other than to wait. Yeah, there are some people that may have some underlying conditions before commencement of family planning methods. Conditions like irregular ovulation, people that have some form of hormonal imbalance, then people with PMOS, they have these issues that are there. And you know what family planning medications do is that they artificially regulate the cycle, keep it in check. There's no pregnancy, but everything just goes normal. So upon discontinuation, what now happens is those underlying things will now become unmasked and probably become more obvious. So it may also contribute to a longer delay in the return of normal reproductive activity. Yeah, there are some situations as well that you know, when you're on family planning medication, you are supposed to be in contact with your healthcare provider for any noticeable side effects. With this as well, it will, over time, the provider may decide to probably discontinue the medication and switch you to another method. That will be all for this week. Till next week, we will continue to address your health and fertility concerns. Don't forget to subscribe and turn on your post notification button to get your updates on our new videos.